Now I'll hand it over to Dr. Narda Robinson to begin our presentation.
Thank you, and thanks for coming today or watching on video. I am going to speak about the top 10 clinical applications of medical acupuncture. So I'll just get started by sharing my screen. And put out presentation. Good. And so if you haven't heard of medical acupuncture before, I'll just explain that briefly. Medical acupuncture is the biomedical scientific approach to needling and other techniques related to acupuncture, but we don't teach or practice the traditional Chinese medicine. And one of the biggest reasons for that is that how acupuncture works can be explained completely and scientifically, and we don't need to rely on myths or metaphors. So I find that a lot more rewarding. And you can't measure a metaphor scientifically. You can't say, oh, there's dampness in the spleen and how will that resolve? It's just an allegory. It's something to describe physiologic processes from the pre-scientific era. But now we're thousands of years later, and we can talk about nerves and like autonomic nervous systems, central peripheral nervous pathways, and myofascial restrictions and fascial sensory elements that are how we know that acupuncture works based on research. So that's how I'm going to approach this today. And at CuraCore, and website curacore.org, and I'm speaking on the vet portion because I'm an osteopathic physician and a veterinarian, and so I have a human and a non-human, teaching business. So anyway, so yeah, after teaching at Colorado State University for 20 years, plus teaching acupuncture on the side since 98, then I've now solely gone to my own company, and that's what CuraCore is. So for most Canadians that are pursuing acupuncture training with us and certification, since the pandemic, we started this EMAV for veterinarians. So you can find this brochure on our website, and I think it's in the booth as well. But this is where we have the same intensity of the medical acupuncture science and philosophy, and how you implement it, clinical conditions for small animal track and large animal. But now we've got a really, it's fun and it's interactive and engaging distance learning program, and that's what we call EMAV. So for those that don't want to deal with the quarantine of coming back to Canada or travel at all, and I fully understand that, we have on the top right here, we have at least part of the EMAV gear kit that we send, which includes an electroacupuncture unit and an animal model that you will use with push pins to find the points first on the animal model, and then upload videos about that. And then we have conversations and all that. And then you use an animal that might be in your clinic or might be your own animal. And so there's a lot of back and forth, a lot of individualized learning that we have. And then if you did want to come down and join us at our school in Fort Collins, either as your main certification approach or after you graduate that pathway, and then want to come on site for 2 days or more, then we have ways that you can add that on-site piece also, or you can just go directly the old-fashioned way, which was the online didactic plus the on-site clinical. So it's hybrid either way. The online modules are the core curriculum, and then special tutorials, and then either we do the clinical intensive portion from a distance or on site. So your choice, but everybody that signs up for the course gets a copy of my book, Interactive Medical Acupuncture Anatomy. And this is based on human anatomy research, but this is where the acupuncture points for non-humans comes from. And so by understanding the innervations, the vasculature, the muscle intersections, the fascial restrictions, anything like that, that all comes from the human template. And so there's so many more points that are from the human that we don't even cover because there's so many to even address, that you can find them in my book and then translate that to a species if there's some other point you really want to use or are curious about. So for today, I'm going to just talk about these 10 conditions, but in the context of understanding how acupuncture would work scientifically to alleviate them, to help the patient restore function and homeostatic balance and reduce pain and all that. And I will probably go the full time. And so if you want to talk to me, I'll have my email address at the end, but essentially my email is narda@curacore.org. So NARDA at CURACORE.org. But the 10 conditions that seem to be, just floating up to the surface of things that everybody gets so enthusiastic about that are representative of, just the panoply of conditions that we can implement acupuncture for. And I've grouped them into nerves and anatomical structures. So from the cranial nerve perspective, facial nerve injury, and then dry eye, and I'll talk a little bit about those too. And then peripheral nerves, things that have to do with a peripheral nerve injury, such as radial nerve injury, stifle instability, which I see as, the sensory motor disintegration of whatever is holding that stifle joint into place. And so it's much more to consider than just the cranial cruciate ligament. So there's so much going on that stabilizes every joint, but especially that stifle joint. Those muscles have to be active and balance, the agonist, the antagonist. There has to be sensation from the structures around the joint that gets to the brain and then can have a motor output to stabilize, to stiffen the muscles, all that stuff. So it's much more complex than most of us have been led to believe based on our training. And then something like diabetic neuropathy. How can we improve the function of the muscles, the fascia, the nerves, brain, spinal cord, etc. So then we can get into the autonomic nervous system realm, inflammatory bowel disease, postoperative ileus. So what I want to do is just give you a quick summary of the structures in our body, why we don't have to rely on invisible chi. There are structures in our body that will mediate the sensation from how acupuncture needling gets from where you're stimulating a site, which is like a peripheral nerve and the somatic afferents, and then how that affects different pathways in the body. So also spinal cord injury, osteoarthritis, and back and neck pain. So as we go through each of these kinds of structures, I want you to see that if we have acupuncture points, and again, I'm a human physician and a veterinarian, so I sort of bounce between the two. But on the left side, you see acupuncture points around the eye and on the face. But from a neuroanatomic perspective, we can see that so many of these points on the face are actually places that cranial nerves emit from or transmit through. So bladder 2, the supraorbital nerve, and then stomach 2, the infraorbital nerve. And don't even worry about the names. These are organ names that have been inherited, but what we can understand and rename if we wanted, but then we get out of the World Health Organization nomenclature. So even though we're strongly neuroanatomically based, neurophysiologically, myofascially, we still keep those old names because it helps us communicate with our peers. It helps us just be within that body of literature. But we know what we're talking about. It's shorthand for, so bladder 1, bladder 2, like the infratrochlear nerve, the supratrochlear nerve, Yu-Yao, the supraorbital nerve, just different places. But we're not believing that this has anything about the bladder when we have our bladder points. It's part of the line that was described long time ago and given a name that we realize it's not really related to the bladder for most of the points on the bladder line. And then just to note, from translational perspectives, that humans have a complete orbit versus when we translate it to somebody like a dog, they have naturally an incomplete orbit. And so as veterinarians performing acupuncture, we take all that into account and we just indulge ourselves in the translational anatomy. So whether it's the infraorbital foramen in a dog or a bovid, we can understand that that's a branch of the trigeminal nerve. And instead of looking at the traditional Chinese medicine actions that say clear heat, benefit the eyes, expels wind, and relieves pain, we can understand it through neuromodulation. So bringing the nervous system back into balance, taking down, wind up, and helping support nerve function, proper signaling via the infraorbital nerve, which is a trigeminal sensory nerve right there, and that's going to provide analgesia and anti-inflammatory activities along that branch. And so that could be helpful for dental issues as well. And then this stylus is pointing out the stylomastoid foramen, and I mentioned facial nerve injury as one of the big 10 conditions. So we know that the facial nerve comes out the skull through the stylomastoid foramen and then branches. So when we want to treat a dysfunctional facial nerve, we can target where it's emanating to triple heater 17. Don't worry about the name, but everybody that does acupuncture knows that's here, where that facial nerve trunk is coming out, and then target branches, target axons, and the muscles where that facial nerve is supplying the muscles of facial expression. And then peripheral nerves. Well, I mentioned dry eye, so that's for the cranial nerves. That's also a series of cross-talking between the trigeminal and the parasympathetic fibers and the facial nerve. But time is limited, so I'm just going to move on. So peripheral nerves, here's that bladder channel again, starting at the inner canthus of the eye, and then moving down the back in two parallel lines, which are going to talk to or interface with a lot of these spinal nerve branches, and then coming down the back of the leg, which is corresponding to the sciatic nerve, and then branching into the fibular and tibial nerves. So again, these are just layers of the anatomy from my book, and taking away the hamstrings, we can see that big sciatic nerve. And so really we can understand acupuncture based on where the points are. But then what I love doing about my book and having all these layered images is seeing the structures underneath. So and then translating that now to the non-human so that we can have similar points and do similar research. And it's just wonderful. So like with this cat that had a similar condition as a human with what they call sciatica, that I was treating that as I would a human, but deactivating all the tense muscles and modulating the nerve so that it's not so trigger fiery and causing pain. And then I mentioned the stifle instability. This is part of that neuromuscular control of joint integrity. We need to have accurate proprioceptive information and adequate muscle strength. And that's this bidirectional flow into the nervous system. So whether it's a Downer cow and they might have femoral paralysis or obturator nerve injury, we can target certain nerve pathways, which often follow the acupuncture channels, and then get that nerve speaking again to the spinal cord and to the brain. So if we're treating spinal cord injury, I want to address distal points that are affected. So in this adduction, where are things not working, reaching, firing in the limbs, but we also want to address the spinal cord. And there's abundant research about acupuncture and related techniques like photomedicine, which I'll cover tomorrow, on the health of the spinal cord in terms of long-term improvement and reduction of inflammation and improvement of the circulation and facilitating proper nerve reconnections. So, and then just points on the distal limbs where we would also stimulate, and in the web spaces, for example, and that's where we can send more communication that will go into those peripheral nerves and then into the back. I mentioned radial nerve, and there's a channel, again, large intestine line, but it doesn't have much to do with large intestine. So again, that's aggravating, but we can follow that line and realize that that is the pathway of the radial nerve. So if we have radial nerve damage somewhere along from where it exits the brachial plexus down, and we can access certain points and go before and after that break in communication, not broken nerve, but some kind of bruising or some kind of interruption nerve pathway, and stimulate the muscles that are supplied by that radial nerve, stimulate sensation, and generate like some electroacupuncture that's going to activate the endogenous stem cells and get that recovery happening. Aside from the integrative approaches, there's not much you can do from a conventional framework to actually boost the regeneration of these nerves. Stem cells, I'm not really on board with stem cells. Yeah, there is that, but just in terms of drugs and surgery, there's not much that you can do to really influence regaining health of those tissues for the most part. So anyways, spinal cord, spinal nerves, seeing where these points are, seeing the nerves underlying it, seeing how when we have an acupuncture needle or laser stimulation or massage, what's going on there. So this guy couldn't walk after spinal surgery for 1 or 2 types of cancer in the back, and he was going to be euthanized if I couldn't get him up. And this is his mom holding a cookie, and his dad was, about 5 years older than her. They would not be able to lift this animal up. So for his life, and this happens all the time with those of us that are doing acupuncture, we are getting animals up, we are saving lives. And whether it's his back pain, his neurological status, which was impaired here, or the fact that he could have been incontinent, those are all in veterinary medicine, potentially life-ending problems because of euthanasia, and people can't handle that. So anyway, then there's myofascial work. If you've had acupuncture or massage, you get a lot of tightness in your shoulders. Acupuncture can help loosen that restricted connective tissue and the tension in there. And similarly in animals, whether it's the shoulders, back, neck. Here I'm adding electroacupuncture. He had chronic disc problems, as well as a lot of pain there and arthritis. So the fact that we can, so moving into, autonomic conditions and digestive problems, the fact that there is overlapping innervation from sympathetic and parasympathetic realms, but also coming out of the spinal cord and then the vagus nerve and the sacral segments, we can design acupuncture treatments to work with the reflexes, like on the back of this horse. If this horse had either post-op ileus or some kind of chronic colic that was non-surgical, we can normalize that spinal cord function by improving the signals going through there and taking wind up down. So here was some electroacupuncture I did on the back of a horse, because if there's wind up, there's increased sympathetic stimulation, and that's going to slow down GI transit. It's going to just throw things out of whack, and it's going to be pro-inflammatory. So we look at this is a cross section of a human back, but just how the nerves are organized, where the sympathetics are, where do we have to stimulate on the back to get those impulses into the cord to have the desired effects that we want. And then in a cat, for example, with IBD, inflammatory bowel disease, and I'm not sure you can see my pointer, but in the lumbar region, this is where some friends of mine had been treating this cat that came in on ER. Just those lumbar spinal segments, like the horse, that these are the realms that govern the digestive tract in more of the colonic area. And this is just a busy picture that talks about these long loop reflexes from points such as this one called stomach 36, one of the most heavily researched acupuncture points, that not only reflexes like locally near the stifle, also in the lumbosacral cord because of the sciatic nerve innervation, but also all the way up to the nucleus tractus solitarius in the brainstem, which is what we call a somatoautonomic convergence center. I mean, this is all like some of the deep discussion we'd have in the acupuncture course, but strongly supported and analyzed through research. So we're not only improving GI regulation, but we're taking down the inflammation because it's pro-parasympathomimetic, reducing pain, reducing nausea, and then also something like urinary incontinence. We just figure out where are the sympathetic, parasympathetic, and somatic sources of the control over micturition, and then target those pathways to improve the health. So just wrapping up here, this was Jenny Conrad, and she worked on this retired circus bear who had a lot of back pain, a lot of arthritis. They gave him gummy worms because they didn't want to give him gummy bears and insult him. But she's just there. The animal is so happy eating his gummy worms, and she's just working on his back, doing some laser, some acupuncture, and some massage. So in summary, so medical acupuncture is working through neuromodulation and connective tissue modeling. We don't have to go to another ideology or another time, ancient times. We can understand it from what we know today and do the research and understand that it's working on several pathways simultaneously. So I hope to talk to you. If you want to ask more questions or get in touch, there's my email, narda@curacore.org, the 818-0851, that's our office line, but I'm happy to talk to you on my cell phone too, if you want to just email me. So I guess thanks for coming, or thanks for watching this on video. I think I made it.